Hi, my name is Crystal. I'm going to be your sonographer for today. Can you confirm your name for me?
Hi, it's Chris.
Alright, and your date of birth?
September 2nd, 1995.
Alright, and the reason why you're coming in today?
Having pain in my scrotal area.
Okay, and how long has this been going on for?
15 months.
Okay, any surgery to that area?
No.
Trauma?
Yes.
How long ago?
15 months ago.
What?
Do you think they're related?
Maybe. We'll see. What happened?
You know, I got kicked in the nuts once or twice.
Oh,
Maybe 3
okay.
times.
Okay, alright. Well, we're gonna do a scrotum ultrasound today. It's not gonna be hurt. I will use this transducer and we're gonna put gel on your scrotum area. But first, I need you to set up. I will be leaving the room. You can cover yourself with this drape. Take off your pants and
Right now?
no, when I leave. And I'll be right in. Alright, let me know when you're ready.
Okay.
Alright, Chris, I'm gonna need you to hold your penis. Lift it up towards you. Okay. That's good. And then we're gonna need to lift up your scrotum. I need you to lift up your scrotum. I'm gonna place this under for support and you can let go. This is the transducer we will be using for a scrotal study. It is a linear probe and is typically used on superficial structures such as the testes. When the testicle does not fit in the field of view, we use the curved linear probe to obtain the measurements. The first image we obtain is the bilateral testes. We do this to compare echo texture and to make sure they both are in the scrotum sac. Next, we obtain images of both testes on dual screen to compare size and echo texture. We also use color to compare vasculature. Start in the sagittal plane and obtain these views: lateral, mid with color, mid with measurement, and medial. To obtain the lateral view, move the probe towards the patient's side. The mid-sagittal portion of the testicle will be at its longest length. For some patients, you won't be able to fully visualize the testicle in the mid view. That's when a curved linear transducer may be used to obtain proper measurements. When you measure the mid-sagittal portion of the testicle, you measure the longest length and the AP measurement. For the medial view, move the probe towards the patient's midline. You will then image in the transverse plane and obtain the following views: superior, mid with color, mid with measurement, and inferior. You will move the probe upwards to obtain the superior view of the testicle. You will then move the probe down some, where you will see the testicle at its widest portion. This is the mid. In transverse mid, you will measure the testicle at its widest portion. This will be the width measurement. You will then move the probe down to the lowest portion of the testicle to obtain the inferior view.
After you image the testicle, you will then document the epididymis in sag and transverse planes.
In the sagittal plane, you will obtain images of the epididymis with color, no color, and measurements. When measuring the sagittal epididymis, you will measure the length and the AP distance.
In the transverse plane, you will obtain images of the epididymis with measurement and without measurement.
When measuring the transverse epididymis, you will measure the width. That's it for the right testicle. Now repeat this protocol for the left testicle.